age of 29 from North Carolina made the biggest mistake of her life. If she could reduce past 48 hours, she would. What happened? She had an abortion. She was afraid, shocked, and angry. The father wasn't involved in her life either. She was 8 weeks pregnant, and she thought this was the best decision to make. She was wrong. Today, we will take a look at how abortions predict the dehumanization of women. According to Oxford, dehumanization is the process of depriving a person or group of positive human qualities. Following coordinated research from family members, magazines, and libraries, I was very intrigued at the information that I found and thought I should share with you guys. To understand how abortions predict the dehumanization of women, it is essential to first look at how society views it, second, the main contribution, which is the abortion process, and lastly, in great detail, the effects after the abortion process. Let's start by saying why it might be scarcesome to even start the abortion process. The wording that we use today can lead to the dehumanization of women. Our society pursues abortion in a bad light. They use anthropomorphizing language instead of dementalizing language. The media uses this as well to denote a preborn and use this in arguments to change the attitude of listeners. Research and anti-abortion speakers use this language purposely. In Personality and Individual Differences in 2017, the term fetus versus unborn child was used to contribute to the attitudes of listeners. And they do this by using a cognitive process. And it was stated by Gray in 2007 that when they use this language, they do this for the unborn child to be seen as moral patients when they are not moral agents. And when they do this, they are imagined as innocent and suffering victims, which make women sought out to be as monsters. Now that you know what contributes to even considering to get an abortion, we will take a look at the actual abortion process. In this process, you start by making an appointment and using a pill or undergoing surgery, which tear down a woman's humanity, and I will explain why. It is a big decision to make, and you start that decision by booking an appointment. It is a lengthy process. Sometimes you have to go through multiple appointments. Some abortion clinics have waiting period policies, and then funds. It could cost up from $300 to $1,000, and research states that usually minority and people of poverty get abortions, and that just forces an even harder decision on a woman. Health and Social Work Volume 44 in 2019 states how most abortion clinics are far access. And usually people from a small town would have to go take multiple trips to go to an abortion clinic, which deluses more research and adds more stress onto a woman. Now that we looked at the process of appointment making, we look at the different types of abortion procedures in the different stages of pregnancy. And sometimes when you get certain procedures, you have to wait a certain amount of time, which makes a woman gain emotional connection to their child as they wait longer for them to get that surgery or pill. So, talking about the pill and dilation, which is the surgical approach of the abortion, it is the defiance of the norm, which causes PASS, which is post-abortion stress syndrome, and I will talk about that more. Now that we've seen the actual process of an abortion, next we will look at the effects after the process has been completed. There are short-term and long-term lasting effects on a woman. These effects after the procedure can result to a woman gaining mental issues. American Pregnancy Association in 2019 states how emotional and psychological effects are more common than the physical effects. And when those emotional and psychological effects are more serious, they could cause depression. Society and beliefs are very vulnerable to the emotional and psychological effects, as I stated before. Some of these emotional and psychological effects include regret, anger, insomnia, nightmares, eating disorders, and suicidal thoughts, which takes a toll on a woman's body and predicts the dehumanization of women from an abortion. And then you have physical effects after the procedure, which contributes to the dehumanization of a woman. You have cramps, light bleeding, nausea, vomiting, sore breasts, and fatigue, and that takes a toll on a woman's body, and those are just the normal effects that are guaranteed. Then you have the serious complications, which are infection, incomplete or failed abortion, uterine perforation, septic shock, fever, excessively heavy bleeding, chills, and severe abdominal pain. And 35% of women that get an abortion are guaranteed with the serious complications, and they have those serious complications. And just imagine the toll that that's taking on a person's body from the normal effects and the serious complications. So today we have seen how abortions can cause the dehumanization of women. First, we surveyed the language. Then we examined the procedure and appointment making. Lastly, we looked at the tremendous side effects. Now that you know and gained this information, you might can make this an easier, more respectful process for women to go through. not to degrade them for their decision, but to support and dig deeper on information and share to others. So individuals like the 29-year-old from North Carolina will no longer feel dehumanized before, during, and after the abortion process.